Good afternoon and welcome to today's Cobb County Board of Commissioners work session this March 24th, 2026. I'm pleased today that we will have two presentations before the board. The first presentation will be with respect to the North Georgia Elder Abuse Task Force, and our second presentation will be with respect to the opioid abatement program. First, we'll go ahead and tee up the Elder Abuse Task Force, and we'll hear from our Senior Services Director, Ayanna Nicolescu. And Director, you can begin whenever you are ready.
Good afternoon, Commissioners, Chairwoman, County Manager. Thank you for the opportunity to present to you today. I am actually not going to be the one that does this presentation. While I am very proud that Cobb County Senior Services is once again part of this group, and we restarted the meetings at our location. I have here Jill Hollander. She is with the Fulton County DA's office, has been part of the North Georgia Elder Abuse Task Force for about 6 years or so, and has done fantastic work. And in the absence of Jeff Wood, who is the president and CEO of the North Georgia Elder Abuse Task Force, she will present for you today.
Wonderful and welcome.
Thank you so much.
We look forward to your presentation, and you can begin whenever you're ready.
All right.
And I'll also say, although she's an employee of Fulton County, she's a resident of Cobb County and constituent of District 2. So thank you, Jill.
Bow and curtsy.
Wonderful.
We're at your service.
So yes, Jeff Wood, who was supposed to be doing this presentation today, is unfortunately stuck in San Francisco, and our chief, Dan Flynn, is ill, so you guys get me. So what is the task force? The task force is a coalition and a partnership between local, state, and very uniquely federal authorities operating within North Georgia. We work with the agencies both in Fulton, in Cobb, as well as some of the surrounding counties, as well as some nonprofits, all with the goal to identify, to combat, and most importantly, to prevent elder abuse here within the Metro Atlanta area. We have 120 agencies that are associated with us. The federal agencies can include the United States Attorney's Office, the FBI, Secret Service, Homeland Security, but really we've worked with any and all federal agencies when it arrives as necessary. For example, we had a case last year that we had to pull in the SEC. This partnership between state and federal is extremely unique, and it has solved many cases and allowed us to really be incredibly effective. Obviously, we're grateful for the partnership of our local law enforcement. We have cooperation and partnership with all of the police agencies in Fulton, in Cobb, in DeKalb County, as well as the district attorney's offices, which are also very beneficial. Our health and human services, and we do a lot of education. This is both on the law enforcement level as well as the senior level. We go to senior services agencies, we go to long-term care facilities, we speak to doctors. We will go anywhere where people are willing to hear us, because we know that for every one person who hears our message, they're going to share that message with other people. And it's only through knowledge and awareness that we can fight this scourge that is facing our community. We focus primarily on financial scams, as well as physical and emotional and institutional neglect. This is one of my slides. This is one of the things that I really like to do. We go out and we speak to the seniors themselves, especially about the prevalence of artificial intelligence in a lot of these scams. I'm sure you've all gotten the jury duty scam, or the one that's coming around recently about the toll violations that's referencing John Smith in Fulton County. Obviously, their clerk is not John Smith, it is Shay, and we do not have a magistrate or a state court judge also by the same name of John Smith. But these documents are created using artificial intelligence. And so we've used artificial intelligence to teach what it is that the seniors are saying. If you look at this picture, there's something very wrong with it. There's actually two things that are wrong with this particular picture. And the one thing that we like to point out to our seniors is one of the big things you look at is the hands. He's got too many fingers. If you also look at the pen, it's a pen and a pencil, and it's bent together. And by looking at the images, by speaking and carefully examining the circumstances that we are presented with, we can identify what is real, what is not real, and hopefully prevent our fraud. Along those lines, I do have some of these, if I can pass them, I'm not sure what the way to do that is. This is the Fulton County SAFE Initiative, and that stands for S is stop. We ask people to stop. If a solicitation, a mailing, a person comes up to you, a phone call, whatever it is, any unexpected communication that happens, stop. Analyze the situation. Look at this document. Ask yourself, what is it that this person is asking me to do? What is happening here? Reach out to a family or friend. Why? Because elder abuse, just like all other of these types of fraud, rely on our emotional reactions. The scammers are looking for us to use our hearts rather than our heads. So we need to reach out to somebody who is not involved in that emotional situation. Ask them, does this make sense? And it doesn't matter which of these types of fraud it is, they're all going to have the same crux, and that's going to be the necessity for an emotional reaction. So ask somebody who's not involved, and then exit. Get out, hang up, walk away, close the window, whatever it is you need to do to extricate yourself from that situation. That is how we hope, as part of the Elder Abuse Task Force, that we can keep our seniors safe. And on the back of it, we've got our tips and tricks. One thing that I'd love to point out is I am also the animal cruelty prosecutor for Fulton County. So we've used, also AI generated, there's nothing wrong with this picture, a dog to include the recognition that our animals are most frequently used as tools in abuse. Since we've been keeping statistics in Fulton County, when a companion animal is in the home, that animal has been somehow used as a tool of that abuse every single time in 5 years. Most frequently, it is what we call in domestic violence, coercive control. That animal is used to control our elders. And the task force has done an incredible outreach to include animal services, to include animal nonprofits, to spread that word that when a senior comes to a shelter or makes a report to our law enforcement that someone is threatening their animal, that we need to take that very seriously, because the animals are used first. They are leverage, they are our family, and the cases can be prosecuted together. Georgia is unique that emotional abuse of a senior is a felony. Using an animal as a tool to abuse a senior to get to their financial resources is a felony, and we need to make sure that that is recognized. And the task force has done a great job in doing that. So this is our new website. Unfortunately, we lost Joe Garvalis, who was the absolute amazing founder of this task force. He brought us all together, and we are so proud to be able to be here to carry on this important initiative in his name and in his memory. And I know that we're giving out the Joe Garvalis Award for 911 operator up in North Georgia, I think next week. But we have, the foundation is carrying on. We've got a new website. I'm happy to serve on the board of this task force now. And we look forward to expanding our reach as well as continued partnerships with Cobb County, with Fulton County, with DeKalb County, with everyone else, because we know that elder abuse does not stop at county lines. It does not stop at city lines. It's everywhere. And the billions of dollars that are stolen from our seniors annually are funding horrible things in our community. We're talking about human trafficking, narcotics, weapons. They're not buying Girl Scout cookies. So we're taking from our seniors and we're giving it to horrible things. And we can keep our county and our cities and our citizens safer by stopping this abuse. So I thank you for your time. Happy to answer any questions that you have.
Thank you. Appreciate you joining us today and for the effort to revive this initiative, as I know it's quite imperative to be aware of these things because of the prevalence of older people in our community, and because we also have parents and family members who are aging. And so I know this presentation hits close to home for me as well. Do any commissioners have any comments or questions?
Just keep up the good work.
Thank you so much. Happy to be here. Happy for your time, and please reach out if there's anything that we can do.
Thank you. Appreciate it.
I will just add that since I have personally been part of these meetings, there's such an incredible value in having all these partners at the table. Just in sitting in one meeting, I was able to reach out to my left, and the ladies from the ombudsman, were there. I had just gotten a letter regarding a facility here in Cobb where there are, some issues, and a constituent reaching out to me regarding their mother who happened to live there, and issues. So I was just in that one meeting, I was able to connect with the person and make sure that somebody goes and checks on there, on the situation. So the connections that we make and the cases that we hear about, the way in which, all of the different departments being, local, state, even all the way to federal level, as she said, it is truly incredible to see. So there's a lot that's to come, and hope that you can, share the word about it and encourage people to stay aware. So.
Thank you. I do have one question
Yes, ma'am.
for you. I remember in the past there was a phone number that someone could call if there was a suspected case of elder abuse, or like a case manager that could reach out.
Yes, so Adult Protective Services does have a phone number. Hold on one second. I'll give it to you.
Okay.
We do have a blue trifold that I usually bring, but I didn't want to bring too much Fulton County stuff up here.
Okay. Okay, let me see. I have a trifold right in front of me that Commissioner Burrow just handed to me. I see a website. I don't see the phone number. Okay, so it's 866-55-AGING for adult.
Yes.
That's what I was remembering, Adult
That is
Protective
Protective
Services,
Services.
because we're so familiar with Child Protective Services, but there also is a dedicated effort to address adults that may be facing abuse.
Yes, so Adult Protective Services and Department of Family and Children's Services, DFACS, are they're both under HHS, but they're separate.
Okay.
And also, very importantly, just to get out here, because I know that this will be broadcast, reports are anonymous. And so long as a report is made in good faith, you are protected from civil liability if you make that report.
Okay.
So we won't, obviously, the DA's office will know who it is that made that report, but the person who is the subject of that report will never know who made it. And it's always better to report and be wrong than to have been right and regret it later. So obviously, we encourage everyone to report abuse. We cannot act on what we don't know.
Okay. Thank
And
you.
they're also part of these meetings.
Yes.
So representatives from Adult Protective Services are part of these meetings in this group.
Okay, very good. Thank you.
Thank you.
Appreciate it. Oh, we do have
Question?
another question.
Not a question, but also, and it's on here, always call 911 for life-threatening or emergency.
Always, yes.
Yes, sir.
Yeah, do we have anything like this for Cobb?
I do not, I'm not aware of anything that we have specific to Cobb County.
No.
We do have the brochure from the North Georgia Elder Abuse Task Force. Now, I do know the sheriff's office, the DA's office, and in Cobb do a lot of work, in this regard. I mean, there are community impact teams come out to the senior centers and speak, to our groups all the time. But I will check and make sure if a handout exists that we can.
Okay, thank you. And Jill, where do you all put these in different places, doctor's offices?
I bring them everywhere. If I go to
wherever
the
we can.
doctor, I drop them off. If I have to go get blood drawn, I drop them off. I put my stuff everywhere. I'm happy to send you the PDF for that. If you want to take our logo off and put it on it, we share.
Okay, perfect, thank you. R&D, rip off and duplicate. There we go.
It's all about the mission, not the messenger. So happy to share.
All right, thank you so much again.
Thank you.
All right, that now takes us to our second presentation to receive an update on the opioid abatement program. And that presentation will be brought by our EMS Division Chief of Cobb Fire and Emergency Services, Nick Adams.
Thank you. Thank you, Chair and Commissioners. My name is Nick Adams. I am the EMS Division Chief for Cobb County Fire and Emergency Services. You have also appointed me to be the non-voting chair of the Cobb County Opioid Abatement Advisory Council. I'd like to give you a progress update and also thank you for appointing this board back in April of 2024. By doing so, you made a clear statement about the importance and how serious Cobb County takes this crisis. Let me kind of briefly give you an update about where we are in this opioid epidemic. These numbers are a little bit old. They're from 2022, but in 2022, we experienced 143 Cobb County citizens died due to opioid abuse. 128 of those 143 were specific to fentanyl-related deaths. From 2018 to 2022, our deaths increased on an average of 15% per year from 18 to 22. And currently we're experiencing 18.5 deaths per 100,000 Cobb County residents. I realize that these numbers are a little bit old. This is what the state had for us most recently. I do want to point out that in 2022, we were in second place in the state of Georgia, eclipsed only by Fulton County. And in Fulton, in fentanyl-related deaths, we were third in the state. To give you a better snapshot of where we are right now, this is data I pulled directly from our database at Cobb County Fire. So this is how many doses of Narcan we've given out per month starting in 2021. That first bar is May of 2021. You see the peak in 2022. And thankfully, that seems to be our highest peak. We seem to be kind of coming down quite a bit. While we are seeing a reduction in how much Narcan we are giving in the field, we still are experiencing a significant epidemic. To increase that, we think some of the reasons we may be seeing a reduction as well is the availability of Narcan in citizen hands as well. So we're still experiencing a significant issue right here in Cobb County.
Are just Cobb Fire numbers?
Yes, ma'am. These are just Cobb Fire numbers, so these do not include the police departments, Metroland Ambulance, or Puckett EMS.
Okay, thank you.
These are just Cobb Fire. But just give you an idea of kind of where we're at and what we've seen over the years and over the months.
And just to be clear, when you say this is Narcan that you as a fire department have it administered?
Yes, sir. Yes.
So, okay.
Yeah. So let me kind of walk through kind of how we have got here over time. In 2018, the board authorized litigation against opioid manufacturers and distributors. Settlement money started coming in 2021. That's not when we received it here in Cobb County, but this is when the settlement dollars started getting approved and filtering down through federal and state agencies. That was against McKesson, Cardinal Health, Johnson & Johnson, and Janssen. At that time, the Georgia MOU was executed, and that's important to note because a lot of the rules that we are following as a advisory council are placed in the Georgia MOU. In 2023, additional settlements were approved from Teva, Allergan, Walmart, Walgreens, and CVS. And then in April of 2024, this board established the Cobb County Opioid Abatement Council in accordance with the Georgia MOU. In May of 2024, the board approved the council membership, which I'll go over in just a moment. And in October of 2024, the board approved the 2026 through 29 opioid abatement strategic plan, which had been put together by the council based on feedback from the community. We opened up an application cycle that went from May to July. And then since that point, the council has scored all submissions, and this evening we are presenting to you our recommendations for board approval. The council membership is made up of 8 individuals. 3 of these individuals were required under the Georgia MOU. That includes Melanie Dallas, who was appointed by the Community Services Board, Lieutenant Colonel Stacy Baines, who was appointed by the Cobb County Sheriff, and the Pete Kionis, who had been appointed by the Board of Health. All 3 of those positions were required under the Georgia MOU. The remaining 5 positions was appointed based on best practices as presented to us by the state as to who we should have on the advisory council. Those include Blake Schneider, who is with Kennesaw State University, Dr. Kimberly Henderson, who's with us today, who is an SUD treatment provider here in Cobb County, Christopher Hansard, who is also here with us today, appointed by the Chief Judge from Superior Court, Holly Touchman, who I don't believe could be with us today, who is a survivor impacted by addiction, and then myself, who is serving as the non-voting chair. I do, real quickly, if you don't mind, Chair, I would like to have those individuals, if they're with us today, please stand up so they can be recognized. Thank you. Thank you, Chair. So what has the council done since being appointed back in April, May? We established our membership. We have been meeting monthly and sometimes more frequently, depending on the workload. We've conducted a community tabletop in addition with public health, which we had 15 organizations that helped shape the strategic priorities that we presented to you. We then presented those priorities to the board. Again, like I said, the application cycle opened and remained open for 60 days and was advertised. And then once we received the applications were scored using 2 phases. We maintained community engagement throughout the process. We had an open house where we conducted a tabletop exercise to help form our strategic priorities. All of our council meetings were open to the public and advertised, and all of our board members or council members attended other opioid meetings throughout the community. So what happened after the 60 days was closed? We received more than 36 applications from 36 organizations requesting a total funding of $33 million. At the bottom of this slide, you'll notice that it says currently that we have nearly $11 million available for distribution this cycle. Since this presentation was created, we have since received an additional buddy, you might have to help me out. $3.75 million through a settlement with Publix. So we currently have about $15.6 million available in the fund from the settlement. All applications were scored using 2 phases. The first phase was conducted by an independent outside agency. They graded the applications based on a rubric provided to us by the state. It was a 130-point rubric. At the end of that process, every application that scored below 100 was removed from the process. Usually either items were missing or they were non-compliant with some of the things that we were limited to use these funds for through the settlement agreement and the Georgia MOU. Once the independent assessment was done, each applicant was then again scored by the council using a 4-point scale. Everything we will be presenting to you this evening scored both above 100 points through the first assessment and scored above a 3.0 on the second assessment through the council. If there was ever a conflict, the council member would recuse themselves from the vote so to maintain impartiality. What's going to happen next, should the board approve our recommendations this evening, we would like to move forward with notifying the applicants of the decisions, those who were awarded and also those who were not. We would like to reach out to the non-selected applicants to discuss their applications and make recommendations for improvement. We would then execute grant agreements through the legal department moving into spring of 2026, and the funded programs would begin service delivery in the summer of 2026. We would then continue to monitor grantees and report annually to the board as required by the agenda item that established the council. And then moving forward, we would like to go in, it's not included on the slide, I apologize. We would like to go into round 2. Obviously, we now have more funds than we were expecting at the time we made our first recommendations. So we would like to continue the process to make recommendations to the board to get the funds out to the community as we move forward. And then we are required to reevaluate strategic priorities in late 2028 and report back to the board with our further recommendations. Any questions?
Thank you, Nick, for your presentation.
Thank you,
We do
Chair.
have one question so far.
Me?
Yes, please.
I think there was some.
Do you have a question, too?
Thank you, Nick. First of all, to you and the committee and staff, because I know this has been a long, detailed, and arduous project, but you've done a great job in your committee and staff, so thank you. So I know you just said how much we actually have now, but of the ones that are on the agenda to be approved tonight, what is the total amount that this first phase will distribute?
Yes, ma'am. So tonight, our recommendations are for 10 projects or 10 agencies totaling almost $5.8 million is what we're recommending this evening.
And it's 10 different agencies? that
Yes,
are-
ma'am.
Okay. So of the 36 that applied, are all the 10 that are on the list the total number that were eligible or that qualified?
No, ma'am. Thank you for asking as well. The mission of the council was to evaluate the projects both for under several traits. One, to make sure there was no duplication of efforts. So we didn't want, if we had 2 projects, I'll give you an example. Let's say we just had 2 projects that wanted to distribute Narcan in the same area. We didn't want any duplication of efforts. So they were evaluated based on that. They were evaluated based on affordability. There were some projects that at the time we didn't think we had enough funds to fully fund. Some projects were also evaluated based on, for lack of a better term, bang for the buck. Was the money being used appropriately, or was it being used the most economical way possible? So each project was evaluated based on a number of factors. They were then scored by both the independent agency and the council. And these 10 that we're recommending today, we feel are the most appropriate use of the funds.
Okay. So let's say of the 36 that applied, we're doing 10 tonight.
Yes, ma'am.
Were there other ones of those 36 that met the qualifications, and would they roll to the phase 2, or do they have to reapply all over again? And will new organizations be able to apply in phase 2?
Yes, ma'am, thank you. We do plan on approaching some of the organizations that were not recommended this time around. In some cases, there were just items missing from their application, or some certain things just weren't fully clear to us. We would like to approach those organizations to see if we can adjust their application or clarify the items that may have been missing. And yes, we do intend to open phase 2 based on board's guidance. We would like to move forward opening up phase 2 and allow new organizations to apply as well. We were told that some organizations did not apply for this first round because they kind of wanted to see how things went, and they intend to apply in future rounds.
Okay, so the ones that are, the 10 that are qualified and on the list for tonight's meeting, can they reapply in a different category or something? Or they're
Yes, ma'am.
done?
I would say that the funds can currently only be used in 4 different ways: harm reduction, treatment, prevention, and recovery. So we do anticipate that there might be some organizations that would like to apply in one of the different categories, or even the same category to improve the program that they may have already started. So based on board recommendation, we do see the possibility for organizations to apply in different areas. Just one of the recipients is a large organization who does a lot of things in the community. It's quite possible that they would like to open another arm of that, if that makes sense.
Okay. And then one last question, if I may. Reporting. How are we tracking how the money's spent, and, you know, are they required to do quarterly reporting, and would the committee that's in place now be oversight for that, or who's going to be coordinating that?
Sure. One of the things the board did do, we brought on an outside consultant or advisor to assist us with reporting. We do intend to do quarterly reporting with the organizations, working with legal and finance. We will be allocating 25% of the award of funds to each agency initially, and in order to continue to qualify for funds, they will have to report and make sure they're meeting their key metrics that they stated they would meet in their initial application given to the council.
Sounds good. Thank you.
Thank you.
Do board members have any other questions?
I don't have a question, but can I make a statement? Of course. I just want to say thank you for the work in this, and I'd be remiss if I didn't go back to that slide where you talked about the Narcan.
Yes, sir.
Only because each one of those administrations of Narcan potentially represents a life that was saved.
Yes, sir.
And the crisis that we have, those are just not numbers of a drug being administered. Those are family members. And so this is a very serious issue, but I want to thank you and the fire department for the work that you do.
Thank you.
But also recognize that these are just what we're intervening with, not what the general public is also intervening with. So these funds are going to go a long way to help families in Cobb County have less empty chairs around the dinner table. So thank you.
Absolutely. Thank you, sir.
Thank you for that thoughtful observation. I
Sure.
do have some questions.
Yes, ma'am.
It's with respect to the timeline, and it may get to some of the reporting questions that Commissioner Burrow had. If we can go to the slide that has the timeline on
Yes,
it,
ma'am.
please. Thank you.
The slide, Chair.
Yes. So we'll have an annual update, but there will be a more frequent update to the board that was over this process?
Yes, ma'am. Yes.
Okay.
Yes, the council will continue to meet. We intend to resume meeting in May monthly.
Okay. And then there is a strategic plan that the board approved. However, I saw something, I don't know, is this the slide that I saw? This is the progress. I'm looking at the time. Is there a timeline slide moving forward?
Oh, yes, ma'am. I'm sorry. Is that?
Okay, yes. Give me one moment. Yes, my first question, I know you and I have met, and when I reviewed my agenda book, I reviewed it online. I don't know if we had an attachment that had the awardees in it, or will those be announced at today's meeting?
The intention was to announce the awardees at this evening's meeting. I do have
Okay.
a document for the board. I believe it might be the one you're referencing.
Okay, that's all I wanted to know. I don't need to
Yes, ma'am.
be, yeah, but I'm good. I just didn't know whether or not that was released publicly yet or not. We can release it this evening.
Yes, ma'am. That
Yes,
was the
okay.
intention, was to release it this evening.
Just inquiry, okay. Thank you. And, let's see, other questions? Oh, it said reevaluate strategic priorities. Can you tell me what was the plan for doing that after the annual report to the board? My only thought was, could strategic interests be considered at that one-year reporting level to the board, or do you plan to just give 2 years for execution to see how things go?
Yeah, that is part of it. So our current strategic plan that the board approved is, it was a 3-year strategic plan from calendar year 2026 to calendar year 2029. Part of that required us to reevaluate the strategic plan in 2028, but yeah, there's no issue with us
I see.
updating the board annually.
That strategic plan is not directly tied to funding.
No, ma'am, no.
Okay.
I will add, though, that we would like to have a little bit of time to just see how things are working.
Yes.
Yes, ma'am.
Yep, makes sense. Okay, that's all the questions that I had. And again, I appreciate you contextualizing this for us to know we're helping real people, even though we're seeing numbers. These are
Yeah.
real lives that are being impacted by this. I know a number of organizations have been waiting with vigor for
Yes, ma'am.
these funds so that they can strengthen how they're serving people today. So I look forward to tonight's announcement so that we can get these programs started
Thank you.
and supported. Yes.
And I don't have a question, I just wanted to say thank you.
Thank you.
This has been nearly a 2-year process, so thanks to you and also the council members that are present and the ones that are not. Thank you for the work that you've put into this.
Thank you,
Appreciate it.
Commissioner.
And Jimmy Geesey.
Ma'am, if you don't mind, I actually,
Thank you, Dr.
I
McMorris.
noticed my,
Started.
I noticed my notes, I failed to mention members of staff that have been assisting with that, and if you give me the permission, I'd like to mention their names now, if that'd be
Please
okay.
do.
We would like to thank Lauren Bruce, Buddy Tesser, Jimmy Geesey, and Shamika Pearson, who played a very important role, attended all the council meetings, and kept us steered in the right direction. So thank you to them, and especially to Jimmy, who we miss very much.
Yeah.
Thank you.
Thank you. And thank you to our own Commissioner Burrow as well
Yes.
for serving on the committee.
Thank you very much.
All right. With that, I believe that concludes the presentation for today. Commissioners, we do have our evening regular meeting that will begin at 7 p.m. We hope that all who tuned in today will come join us back here tonight for that meeting. With that, we're adjourned, and thank you, Nick.